My name is Augustine Chebaruet, and I am presenting to you a topic about restraints in fulfillment of nursing 410 issues and trends in nursing. So, at the end of this presentation, some of the objectives that we're looking into accomplishing include the fact that you should be able to define what a restraint is. Secondly, is the learner will be able to identify two scenarios where the use of a restraint is appropriate. Thirdly, is the learner will be able to list two types of restraints. And fourth will be the learner will be able to differentiate between a chemical restraint and a physical restraint. So just to give you a background on what exactly is a restraint. By definition, Casey and Casey 2010 refers to restraint as any device or medication that is used to restrict a person's voluntary movement. And as you can see, there is also in the PowerPoint there that there is a lap belt, there's also mittens, things like that. In terms of chemical restraint, some of them could be antipsychotics or anxiolytics by themselves and things like that. For example, lorazepam, diazepam, and such. So there are some of the myths out there about restraints, and some of them that have been put forth includes some people would say that it does improve the quality of life, and that is absolutely not true, and we'll look at some of the facts that debunk those myths. Some of the myths include the fact that it will decrease falls, which is not true. Some facilities also, or some individuals may think that it does lower costs associated with staffing, which is also a myth, and that some will say everything else has been tried, we don't have anything else that can help this resident or patient. And someone will say, it decreases lawsuits, and all those are false. Some of the statistics in the United States, the prevalence indicates that the following: that between 7.4% to 17% of physical restraints that are used are more in the acute settings, while 37s are in long-term care, which chemical restraints in long-term care again is around 34. And this really was one of the issues that really made this topic important to me and want to know more, as well as to present to you why this is important. A physical restraint does restrict or control the movement or behavior. They can be attached to a person's body, or create physical barriers. Again, chemical restraints refers to any drug that is used to discipline or convenience and not required to treat medical symptoms. So again, that borders again along the antipsychotropics, as well as some of the antidepressants, which some of the literature use some terminologies which include psychotropic medications instead, just to be able to address and make sure that it's not being used as a restraint. There are also environmental restraints, and these entail the modification of the resident or a patient's environment in order to restrict a free movement. And some of those could be, just putting a bedside table in front of a resident or a patient. Some of there are indications, of course, for restraints use, and that could include non-violent or non-self-destructive behavior, or a violent or self-destructive behavior. And an example is, a restraint could be used when a patient with an unsteady gait, increased confusion, is agitated and becomes restless, and is definitely known to have a history of dementia, but now has a UTI and keeps pulling out an IV. That can certainly be one of the indication for the use of restraint. Another indication for restraint could be when somebody is violent and has a self-destructive behavior. And for instance, a patient responding to hallucinations that commands him or her to hurt staff and plunge aggressively may need a physical restraint to protect everyone involved. And again, are there any other alternatives? Just think out there to that situation. Perhaps not. Some of the unintended consequences, and this really highlights why this topic is important to me, having and continue to work in the geriatric population, is the detrimental effects that they do have, especially in that population. And given the fact that this is a population that is highly affected by this, and some of them include, asphyxiation and loss of strength because their mobility is decreased and they cannot exercise their free movement, pressure ulcers. You can see the picture on the bottom right on your screen. There's also incontinence, which could lead also to skin tears and thrombosis and cognitive declines. Also, self-esteem is really affected. There's confusion. There's also forgetfulness, depression, fear, agitation, gait imbalance, and memory impairment, as you said, just to name a few. There are other alternatives to try rather than using restraint, and this could be included, decreasing stimulation, bringing resident to close to the nurse's station, using one-on-ones, sensor alarms, and family participation, positioning the bed to a lower position, making sure the calls are within reach, also the patient. Again, thank you so much, and I hope you did learn something from this presentation.